My daughter Becky was 2 years old when my husband and I had to deal with, her having pneumococcal. So it all started with a very common, simple cough and cold, which, was diagnosed as flu, then later became bronchitis after a few days. We gave her antibiotics, lots of fluids and rest, and, I thought it was just another, bout of flu and that it would pass eventually. But that didn't happen, and in fact the fever escalated, and very often it would be above 40 degrees each time. This went on for like 4 to 5 days and the fever wouldn't break, at which time we were very worried, and we decided to take her back to our pediatrician, who then decided, okay, we have to take an x-ray and check out what's happening with her lungs. And the x-rays showed that her lungs were clear, so he said, it's not pneumonia, you don't have to worry about it. We'll just continue to pump her with antibiotics and soon, it will be okay. We decided that she better go to the hospital, at which she was given a CT scan that showed that there was fluid trapped in her lung membrane, something they call an effusion. And the doctors and the surgeons told us that the only way that they could remove that water in the lungs was to do keyhole surgery to drain it out. And we were really quite worried and upset, only because she was very young and she had to go under GA surgery, and we were very anxious. But to save her life, there wasn't anything else. Every day the fluid was increasing. After she got out of surgery, they put her in a high dependency ward for 3 days, and in which she cried most of the time. We weren't allowed to stay with her, and she had these 2 hole-sized tubes that were sewn to her body to allow the continuous drainage of fluid. She was very upset. To stop her from pulling out these hoses, the doctors had to put her on a morphine, and she cried practically throughout when she was not sleeping. She didn't eat, and she was very terrified throughout the entire stay. This experience was very real for us, and it has been life-changing and very costly. So as a parent to parent, I would strongly advise that you actually seek out your medical professional, your pediatricians, to find out how you can protect your child, because I almost lost mine.